Hi, this is my HENT with cranial nerves video with the breast exam and respiratory assessment. Before, as I came into the room, I would wash my hands, introduce myself to my patient, and as I am introducing myself to my patient, I would say, hi, I am Lainey. I am a nurse practitioner. I am here to perform your physical exam. As I am speaking to her, I am doing a general survey. I am observing her skin, if she has any type of sores, lesions anywhere, any type of bruising, scars, tattoos, piercings. While I'm doing that, I'm also observing her dress to make sure she is dressed appropriately for her age and also for the weather that we are in. I would also look for her stature to see if she is, and I would notice that she is a thin white female of average height, about 3 or 4. And then I would also observe her hair and her just overall general appearance for how she is looking. And I will continue to do this throughout my whole entire assessment as I am assessing her. So with the HENT assessment, I'm going to start with the head. I'm going to notice with her hair, I will observe the texture of the hair, if there are any splits, if there's anything going on with that, such as nits or infestations in her hair. I would also look at the color of the hair. And then I would also massage in different places her scalp, just to assess how her scalp is with that. So that would be what I would do with the head. So next, then I would move to the eyes. And as I am looking at the eyes, I would assess her appearance of her eyes. I would make sure that they are above her ear line, that her eyebrows and her eyes are symmetrical, and make sure that they are even. Also, I would be looking at her irises to make sure how her irises look. Okay, if you could look at me. Thank you. Okay, now as we go on with the eyes, I'm going to continue looking at her face also while I'm looking at her eyes, and I'm going to assess for cranial nerve 7, which is the facial nerve. All right, Emma Grace, I need you to raise your eyebrows. Good, you can put it back to normal. Now frown for me. Good. Okay, smile. Show me some teeth. Good. All right, now blow out your cheeks. Okay, those all check out for cranial nerve 7. Okay, next I am going to check for cranial nerves 3, 4, and 6. I had to think 3, 4, and 6. Okay, Emma Grace, I want you, this is my finger, I want you to follow my finger with your eyes without moving your head, okay? Go this way, then go up, over, down, back up. Okay, watch my finger as it comes in. This is checking for accommodation. Very good. Okay, then while I'm doing that, I'm also going to check for confrontation. So Emma Grace, I want you to cover your left eye, and then I'm going to cover my eye as well. All right, and so when you see my hand, I want you to let me know when you see my hand over here. I'm gonna get even with you, okay? Okay, can you let me know when you can see my hand?
I can see it.
Okay, and how about when I get to this
I
point?
can see it.
Okay, and then,
I can see it.
okay, good job. All right, good job, thank you. All right, now since I'm down on her level, I'm going to check her eyes, and in a clinical setting, at this point I would dim the lights, so this way I would be able to check her red reflex. So just look straight ahead for me, and I'm going to bring the light in, and I'm going to check her pupil to make sure it dilates out and it becomes, and they're equally round and reactive, and they are. And with this, I'm gonna go across. Good. Her pupils are both equally round and reactive. Now I'm going to also shine the light here, and I am seeing it reflecting in the same spots in her eyes. Okay, good job for me. All right, now with the exam, I would do this normally on both eyes, but for the length of the video, I'm only going to do it in one eye. And at this point, I'm going to put my right eye to her left eye, and I'm going to look in her red reflex and get into her red reflex. And when I do that, so what I need you to do is look over my shoulder, just straight ahead for me, okay? I'm going to look in her red reflex, and while I am in there, I'm going to view the optic disc and the macula, And then I'm also going to observe the blood vessels and make sure that they are not swollen in any way or crimped up in any form or fashion. All right, Grace, I'm gonna come in, so look straight ahead and you can blink if you need to, okay? I'm gonna get close and personal with you, okay? All right, and I'm able to envision in her red reflex, I'm able to see her blood vessels, and able to see the optic nerve, and they are all intact, and there is no abnormalities, there's no swelling of the blood vessels. I could see the optic disc and the macula and envision them all equally. Now, for this next test, what I'm going to do is I'm going to check her cranial nerve number 2 with her visual acuity, and I've got a Snelling eye chart. So what I need you to do, my Grace, is hold this at a distance of about 14 inches, and I want you to read, do it a little bit closer. And what I want you to do is read the last line that you can read easily.
LGFPH.
Okay, thank you. All right, and she read the bottom line, which means she has 20/20 vision with that. So that concludes the one thing I forgot on the to check the facial nerves. I need you to close your eyes as hard as you can, press them tight, and I'm going to attempt to open them up. Okay, good job. Now I'm going to move from this to the ears. And so now what I'm going to do is, as I'm moving to her ear, I am observing and I am palpating her ear, the pinna of her ear. I'm observing for them, and in the clinical setting, I would do both ears, but for the time of the video, I am only going to do one ear at this time. So as I've palpated, I've checked for redness, I will check for symmetry of her ears, and then I will take my scoop and I will look into her ear. As I'm going in her ear, I'm going to be looking to make sure that there are no scrapes, if there's any wax buildup, if there's any redness. When I get and look into her ear, her inner ear area, I will notice that it is gray and pearly in color. I will also see the bony labrum in there, and then I will also see the reflective light if it is normal. And I would document and report these findings. So with the adult, I would pull the ear back and up, and I would insert, I would put my finger here to balance it and make sure it is good. Okay, and I see the markers and I see the reflective light at about 5 o'clock. Her eardrum is gray and pearly, and it looks normal. There is some wax in the ear that I did observe, so I would tell her that there was wax in her ear. So that would be the exam of the ear. Now also with this, I would assess for the for her acuity of her hearing. So I will whisper behind her. So repeat what you hear me whisper to you, okay?
War Eagle. Best mom ever.
Very good, very good. Thank you for catching and occluding the one ear for me. Okay, now I would move next to do the Weber test. And I have here my tuning fork. And my Grace, I'm going to do the tuning fork and I'm going to put it on your head. I need you to let me know if you hear it in both ears or if you hear it in one ear over the other, okay? Do you hear it?
Mm-hmm.
In both ears or one ear?
Both.
Okay, good job. All right, the next thing I would do is the Renee test. And with the Renee test, I would do the tuning fork. I want to put it on the behind the ear on the mastoid bone. And then when I'm going to activate it, and I'm going to put it back here, and I need you to let me know when you don't hear it anymore. Okay?
I don't hear it anymore. I don't hear it anymore.
Okay. And that is normal because ear conduction is better and more conducive than bone conduction is. So that would conclude my assessment of her ear. I will now then move to her nose. And with it, I'm going to take my scope and I'm going to look in her nose. But first, I would assess and observe the nose, and I would test and palpate her nose. I would also look and make sure there's no deviated septum. And in the normal clinical setting, I would assess both sides of her nose, inspect both sides, but for the sake of the video and time, I will only look on one side of the nose. So I would insert the scope into her nose, and she did not have much drainage, so I'm able to use the same one. And in here, I'm able to observe all of her nose, and it looks normal. I see no polyps, no excessive mucosa or secretions, no type of scrapes or scratches or anything in her nose. So her nose is normal. Now, Emma Grace, I need you to close your eyes, and I need you to occlude one side of your nose for me. And then I'm going to put something underneath you, and you need to tell me what you're smelling.
Not go with that.
Very good, very good. Also, I need you can occlude the other side this time, and I need you to breathe for me. Do you have any difficulty breathing? No. Okay, good job, good job. Okay, so that assessed the olfactory nerve. Okay, now I'm gonna move from her nose to her mouth. I am going to, as I do this, observe how her lips are. And let me back up. I did forget on the eye, when I'm observing the eye, to observe the conjunctiva and the sclera in her eye as well. Now in her lips, I'm observing her lips. For the color of her lips, open up for me. I am also looking and seeing her teeth. I'm going to look on the inside and observe inside of her gums and her teeth, and making sure that there's no decay or anything in there that I can see. All right, now Emma Grace, you can close your mouth real quick. I'm gonna need you to open up your mouth and stick out your tongue and say ah for me. In the clinical setting, I would have a tongue depressor for this. So open up your mouth, stick out your tongue and say ah. I am able to, the uvula is moving up as it's supposed to, so the hypoglossal nerve, that is what I was checking for. Her tonsils, I was able to see both of them. They're equal, they're not swollen, there's no redness, there's no, as I said, swelling, there's no wet patches. It's pink mucosa, and it looks like healthy mucosa. Okay, now what I need you to do is open your mouth again. Can you stick out your tongue? Sorry, this time. All right, do it to the side, do it to the other side. Now touch the roof of your mouth for me. Okay, as she does this, I'm checking the glossal nerve, and checking and observing the frenulum as well. All right, now I'm going to check for her TMJ. So what I'm going to do is put my hands here, and I need you to open and close your jaw. Okay, good. That was checking for the TMJ. I feel no clicking. I feel no crackling with it. Okay, now clench your jaw really tight for me. Clench your teeth. There. That I'm checking the trigeminy nerve as well. Now I have done her mouth. Now going to move to her neck, and at this point I will check her. Lymph nodes. Another thing I forgot to check for was her sinuses. So what I would do is I would tap her sinuses. I would do the temporal. And then now I would also palpate them. Do you feel any tenderness or pain while I'm doing that? Okay. Also, if I had my pen light, I could put it underneath here to observe the sinuses. You can do that. Okay, now back to the lymph nodes. I'm going to feel for her lymph nodes. I'm going to assess them. Okay, and I'm going to assess the pharynx anteriorly and posteriorly. And then the occipital back here. And then the clavicle, sorry.
It's ticklish, sorry.
Sorry. I would feel her clavicle.
Sorry.
There we go. You're good, you're good, you're good. Okay, so with that, I have now felt her nodes. Okay, Emma Grace, I'm gonna come behind you and I'm gonna test your thyroid, okay? I'm going to, when I come back here, I'm going to ask her, okay, I need you to, when I get it ready, I've moved it to one side, I've moved it to the left side, just placed it. Now I need you to swallow for me. Very good, it's a little difficult. All right, that was normal. I felt no nodules on her lymph node. All right, now do to the other one. Now swallow for me. Good. I felt no abnormalities. The thyroids were of the same size, and no nodes or anything on her thyroid. Good job. All right, we're now going to go in advance to the breast exam. So with the breast exam, Emma Grace, do you do monthly self breast exams?
Mm-hmm.
Okay. And with this, I would tell you to make sure that you do it at the same time every month. Usually either the first day of your period or the last day of your period. There's two different ways that you can do the self breast exam. You can stand up for me, and I'm going to show you with this one. You can put your hands and lean forward like that, and this way you can observe your breasts. You would be able to see how they both would hang, and you'll be able to see if there's any dimpling or any abnormal skin looking like orange peel around there. Those are all signs that there is something abnormal. You can sit down for me. Another way is you can lift your arm up over your head. A lot of the times, yes, you can lift your head up. You can do this in the shower. This is one way you can do this, because that way the water helps make it a little bit smoother for you to be able to do. And you can do from a circular motion from the outside of your breast to the inside to the nipple. Then when you get into the nipple, you can squeeze and make sure there's no discharge or anything coming out of the nipple. And also while your arm is up like this, you would go up and to check your axillary nodes and go up here as well. Okay, so that's how we would perform a self breast exam. Now, for the clinic purposes, for video purposes, she is not disrobed for modesty's sake. But if I were in a clinical setting, I would have her in a gown that is open to the front. And with it open to the front, I would ask her, the very first thing I would do would be, Emma Grace, I need you to put your hands on your hips like this for me. You don't have to lean forward. With this, as she's like this, I would be checking for symmetry of both breasts, making sure that they were equal. And that there was no abnormality with them at all. And I would be assessing the skin as well during this time to check for any scarring, any lesions, any piercings, anything abnormal, any discoloration that she may have on her skin. Okay, you can put your arms down. Now for this part of the video, I would lay her back. And so if you don't mind, just like probably like that. There we go. That way we can see it. So what I would do is this part of I would do the exam on both breasts. And the way that I would do the breast is I would take both hands and I would start in an outward circle on the outside of the breast the entire time, palpating around and around, starting on the outer edge of the breast and working my way slowly in. And then once in, then I would express the nipple to make sure there is no discharge or anything coming out of the breast. She would also have her hand up like this as I was doing it. So then, sorry, I'm not going to tickle you. I could do the axillary and then also do up in up her arm as well. That is how I would do the breast exam on her. Now, the last thing I'm going to do is the respiratory. So for that, Emma Grace, I need you to turn around. With the respiratory exam, we are going, my patient, I'm doing this so you can see the back of her. The first thing I would do when I walk in the room is, again, she would be disrobed in clinic, but for video purposes, she will be covered in her shirt for modesty. I would observe her for her breathing pattern, her respiration rate. I would look at her nose, and there would be no nasal flaring. I would see no use of her accessory muscles or no constricting of the neck up here that would show me that she would be in any respiratory distress. Now, Emma Grace, I'm going to ask you to say the word 99 every time I put my hand on your chest. I need to hear, I'm checking for, to make sure it is equal. So say 99.
99, 99, 99, 99.
Okay, good deal. Now, also while I am here, I would also do percussion of the chest. as I was doing that, I heard resonance. I didn't hear any dull areas that would alert me to anything that is going on with her lungs, where there might be some fluid or something to let me know that there is an abnormality with her. Now then, also, I would ask her as she's sitting here, I would put my hands here in the 10th intercostal space and ask her to take a deep breath in and out for me. Good job. As she's doing that, I'm checking to make sure that her lungs expand, her ribs are expanding out, and that they're equal bilaterally, which they were. Okay, and Emma Grace, while I've got you here, I'm going to listen to your lungs on the back side. And in clinic, if she'd come to me and complaining of any pain or any issues with her breathing, I would auscultate first and then do my physical, my percussion and my exam first. So, Emma Grace, take a deep breath in and out for me. Good. Again. Good. Again. Good. Again. Good. Again. And again. Good. Her breath sounds were equal bilaterally. I heard no crackles, no rhonchi, nothing abnormal in her breathing at all. All right, Emma Grace, I need you to face me, honey. And now I'm going to auscultate with you anteriorly. So take a deep breath in and out. Good. Good. I heard normal breath sounds. I did not hear any wheezing, any crackles, any rhonchi. When I walked in the room, I would also be observing for those sounds as well. Now, Emma Grace, what I'm going to do is I'm going to lay you back, and I may have to adjust the video just a smidge and pray it doesn't. I'm over time. Okay, so I'm going to lay you back, and I'm going to check for your diaphragmatic breathing pattern. Okay, good to see it. All right, so take a deep breath in and let it all the way out. Okay, hold it. Okay, now take a deep breath in again and hold it. Oh, good, okay, you can breathe now. Now, what I would do is I would measure the distance between my two markings, which is 2 inches, and I would put that down as my diaphragmatic marking. Okay, thank you, Emma Grace. That concludes my video of my health assessment. Thank you.